This is Channel 2 News at 5.
Patients recovering from surgery often have to deal with nausea. As Channel 2's Earl Ubell reports now, there is a new drug which may at least ease that part of a patient's suffering.
More than 23 million patients are operated on each year in this country, and many of them become sick and nauseated by the anesthesia. Dr. Carolyn Greenberg runs the ambulatory surgery unit at Columbia Presbyterian Medical Center.
It's very common after surgery and is reported to occur in maybe 40 to 50% of patients undergoing anesthesia and surgery.
The FDA recently approved a new drug that should help. It's called Zofran, given by injection just after surgery.
Zofran seems to be a more effective drug than the other drugs that we have available at this time, and seems to be freer of any significant side effects.
Surgery is difficult enough, but nausea afterward can be truly incapacitating.
You would think that controlling nausea and vomiting with this new drug may be trivial, but the patients don't look at it that way.
One of the worst things about the aftermath of anesthesia and surgery is nausea and vomiting. It's really an unforgettable experience, and some patients feel that they want to die.
About half of all surgeries performed today are done as outpatient procedures. Patients go home the same day, and that means the doctor wants to assure the patient that they are okay before they leave.
We want these patients to be able to get up and to move around and to have a normal blood pressure. We don't want them to be sleepy or sedated or faint, because then they'll be unable to move around and they'll be unable to go home.
Zofran costs much more than medications now used to ease after-surgery nausea, $40 a dose rather than the usual 50 cents. But since the most common complication of surgery and hospital admission is nausea, the savings in the long run should be great. I'm Earl Ubell, Channel 2 News.